Hi, this is the first of what is hopefully at least a few videos that I'm about to do based on my upcoming ACDF or anterior cervical discectomy and fusion surgery that I'm going to have. Today is June 5th. I'm having the surgery on June 15th. I've watched a lot of these videos and I'm going to try and keep this as brief and to the point as possible. So, to start with, my symptoms started 9 years ago. Started with shooting, stabbing pain down my right shoulder. That pain eventually went down my arm, and I knew it was nerve pain because I could tell when it went down my arm that it was nerve pain. Then one day I woke up with these three fingers started tingling, and then they went numb. So I called my primary care physician, got in to see the PA. She right away said it sounds like a pinched nerve, sent me to a chiropractor, told the chiropractor my symptoms. Chiropractor sent me for an MRI of my cervical spine. And as you can see from this MRI, I have significant spinal stenosis, spinal cord compression between C3, 4, and 5. So I proceeded to have treatment from the chiropractor, which was traction, electrical stimulation, and laser therapy. That actually helped a lot. It made the pain down my right arm go away. It made the numbness in my fingers go away. Mostly, I probably still to this day have a little bit of numbness in the fingertip of my thumb and index finger. But the chiropractic treatment, which did not include manipulation, and I would say do not do manipulation if you have cervical spine issues, particularly spinal stenosis. But the traction especially helped a lot. So I did that for a few years weekly. And actually, when I first started doing it, I did it twice a week. To this day, I'm still doing it once a week. But after more than a few years, my physician's PA referred me to an orthopedic spine surgeon. I made an appointment, went to see him, and he immediately told me, he looked at my MRI and he was like, "You need surgery right away." So they scheduled me, right away. I even went for all the pre-admission testing, but then I started doing my research, and they wanted to do a 4-level ACDF, C3 through C7. So 3, 4, 4, 5, 5, 6, 6, 7. But once I did my research, also my job at the time, I realized I couldn't get enough time off because I figured I was going to have to take at least a month off. So I ended up going through all the pre-admission testing, but then I canceled the surgery. Probably was, I think, 3 weeks before the surgery date, I canceled it. Called the office, spoke to a woman at the office who gave me a lot of grief about canceling it. So at that point, that was a big red flag to me. So I knew that I made the right choice by not going through them. So that was 3 years ago. After that, I went to a neurologist because I have peripheral neuropathy in my feet. Did an EMG test, which they said came back showing that I have tarsal tunnel syndrome in both of my feet. That's a whole other story. 2 tarsal tunnel release surgeries later, I still have the neuropathy in my feet. So after having the second tarsal tunnel surgery, I went to 2 different podiatrists for these surgeries. He said, "Well, you know what? Maybe that's not from the tarsal tunnel. Maybe that is from your spine." So at that point, I again had the neurologist referred me to a neurosurgeon who was a very, very highly rated neurosurgeon, one of the top guys, if in the Northeast, if not the whole country. So I went to see him. He told me he wanted to do a posterior laminectomy. And I didn't know what that was. And he explained to me that they remove the lamina through the back of your neck and put in rods and screws. And I said, "You mean you don't put it the bone back? No, we do not put the bone back. So I was a bit taken aback by that. Um, so I scheduled the surgery, started doing my research on it, went back to the neurologist, told him that this is what the neurosurgeon wanted to do. His response was, wow, that's pretty old school. So then I started to get a little worried. Um, so I canceled that surgery. Um, I shouldn't say I canceled. I postponed it. I rescheduled it for months down the road. Um, then again, doing my research, and again, as part of this research, one of the things I found was that through case studies, they say that neurosurgeons tend to have better results than orthopedic spine surgeons when it comes to cervical spine surgery. I forget what the statistics were, but it was something like 90% versus 70%. Um, so that's when I realized, okay, I do need to stick with a neurosurgeon. So doing my research, I found somebody out of state who does laminoplasty, which if you look that up, that's a whole other thing. It was developed in Japan. Not a lot of surgeons in the US do it, but it's a surgery where it creates space for your spinal cord uh, while also not limiting your range of motion. So there's no fusion in this particular procedure. But because that surgeon was out of state, um, and I would have had to stayed in nearby for at least 3 weeks to have somebody with me. It was just not feasible. Um, so then I went to another neurosurgeon, somebody nearby me, explained all these different things that 3 different surgeons wanted to do. Um, his comment about the posterior laminectomy was, I would only do that on you if you were 80 years old. I'm not sure what he meant by that, but seeing how I'm not quite 80 years old, um, he basically said, no, I would not do that. It's too invasive, and the results would not have been as good. So he wants to do a 3-level ACDF, C3 through C6. And that's what I'm going with. Going in for the surgery June 15th. And I guess I will report back after that. But the significance of this was I went to 4 different surgeons. Each one wanted to do something different. Again, doing my research, one of the things I discovered is that surgeons, when they learn how to do certain surgeries, they get kind of, they find one that they like, and that's the one that they do. So that's the one that they tell you that you need. It's not necessarily the best one for you, it's the best one for them. So that's why you have to be very proactive. You have to do a lot of research and find out what's right for you. So hopefully, through my research, I have done that, and we'll see how it goes. Talk to you June 14th or 15th.